is Vatsala, and these are my colleagues Mahi and Alison. Our research takes a look at the potential connection between the gut microbiome and autism spectrum disorder, or ASD. Before we delve into the connection, however, let's take a look at what ASD is and how it presents. So ASD is a neurocognitive disorder with two main areas of deficits. You have the social impairments as well as the sensory motor impairments. So with ASD, there are a variety of symptoms that present in patients differently all across the board, but there are a few symptoms that we can use to help in our diagnosis, specifically repetitive movements, social impacts, such as our social impairments, such as not wanting to make eye contact, as well as a narrowed or decreased range of interests. So far, there have been no treatments that cure ASD in totality. However, there are treatments for the specific symptoms of ASD, such as GI distress, sleep disorders, anxiety, and depression.
So now we're going to take a look at what we found. The gut microbiome is composed of millions of bacteria, and one particular species that has been found to be upregulated is Clostridium. Clostridium is an opportunistic pathogen that can cause a variety of GI symptoms ranging from colicky pain, flatulence, to diarrhea. More specifically, Clostridium has been found to produce P-cresol, which is a tyrosine derivative found to be elevated in ASD patients.
And so now we're going to talk about the metabolite P-cresol and its elevation and the pivotal role that can play in the connection between the gut microbiome and autism spectrum disorder. And so the metabolite P-cresol, what it has been found to do is inhibit the enzyme dopamine beta hydroxylase. And so what this enzyme does is it takes dopamine and converts it to norepinephrine. And so in autism spectrum disorder patients with that overgrowth of Clostridium, you see that increased production of P-cresol and thus the inhibition of that enzyme. And so what we see is decreased levels of norepinephrine and increased levels of dopamine production. And so with that dopamine accumulation, it has also been documented that that can lead to increased reactive oxygen species, which we know can promote an inflammatory state. And also with that dopamine accumulation, you can see the increased production of the downstream metabolites, homovanillic acid and vanilla mandelic acid. And so with all the dopamine dysfunction, it has been investigated to play a key role in the underlying pathophysiology of the symptoms of ASD and also more notably the severity of their symptoms as well.
All right, so putting this all together, the dopaminergic dysfunction, which is a key characteristic of ASD, has been and can be attributed in part to the increase in P-cresol due to the Clostridium species. Therefore, the gut microbiome can and should be a future target for pharmaceutical therapy for not only controlling the symptoms of ASD, but also potentially curing ASD. Thank you. Any questions? Yes.
The questions for the students. Real quick, I have a son who's autistic, and I'm so glad you brought this up. About 8 years ago, it's a very humbling notion that we're just basically a host of a bunch of microbes that, determine our brain and behavior. In my lecture, I'll talk a little bit about protect the liver, feed the gut. Hopefully in October, I'll get an expert, or who's an expert, somebody from out of town that will come and talk about the gut flora and how there's over 50,000 different variety of species, some that we haven't yet identified. So this is going to be more and more of the wave of the future about the gut flora, preventing cancers and preventing diabetes, and of course, close to my heart, autism.
Thank you. Yes, so there was just one study that looked at microbiota transfer therapy, so between healthy siblings and their counterparts with ASD, and they could correct a lot of the symptoms that ASD patients did experience. However, the study was really small, and of course, there are a lot of barriers to doing MTT through fecal transfers on a widespread scale. So I think we wanted to put this research out to light so that we could have a therapy that is more easily accessible and readily available.